Hello, everyone. My name is Akinola Shonde. I'm presenting this poster on behalf of the Catholic Relief Services Nigeria Country Program. The title of the abstract is The Impact of Seasonal Malaria Chemoprevention Beyond Malaria Control Among Children Under 5 in 8 local government areas across Katsina and Yobe states, Nigeria. This abstract was jointly developed by Catholic Relief Services, the National Malaria Elimination Program, and the Malaria Consortium Nigeria team. SMC is aimed at reducing malaria-related mortality and morbidity among the 5 children during the period of greatest transmission risk. It involves cyclical administration of a combined anti-malaria medication, sulfadoxine, pyrimethamine, and amodiaquine, popularly referred to as SPAC by caregivers under the observation and supervision of community drug distributors, otherwise known as CDDs. CDDs are community volunteers who are trained to supervise and observe SMC implementation in the communities. Also, during SMC implementation, we have the town announcers and the lead mothers who carry out community mobilization activities during the SMC implementation. So like I said, eligible children get SPAC administration, and sick children are identified and referred by the community drug distributors. So as the community drug distributors move from one house to another, they identify eligible children, and they observe the administration of SP amodiaquine to those children. But for sick children, they are referred by the community drug distributors to the health facilities. SMC has been demonstrated to be a high impact intervention, and several studies have been conducted to demonstrate the impact of SMC on malaria control. But beyond malaria control, in this particular study, we looked at the extended impact of SMC beyond malaria control, like I said. So the objective of the study is to look at the impact of SMC on number of identified monthly morbidity cases in the communities by the CDDs, looking at the referral data, and also all-cause mortality amongst under 5 children during the 4 cycles of 2019 SMC implementation in the 8 intervention local government areas across the 2 states. It's important to mention that this study was conducted in 2020, and 2019 SMC data was used to come up with this abstract. So we conducted a cross-sectional analysis of 2019 SMC program data from cycle 1 to cycle 4, that's from July to October, in the 4 intervention LGAs, each in Katsina and Yobe. Also, we looked at the secondary NHMIS data on DHIS2, on under 5 mortality, and under 5 mortality rates was analyzed from 2018 to 2019. In 2018, in these LGAs, there was no SMC. In 2019, we had SMC implemented with support from the Global Fund, as earlier mentioned. Using existing NHMIS data on DHIS2, the average malaria test positivity rate was also checked. We looked at the analyzed data from 2017, 2018, and we compared it with the analyzed data in 2019 following SMC implementation. And the trend was determined, and they are shown in the results below. We discovered that while we had a rise in malaria test positivity rates from 2017 and also from 2017 to 2018, we observed a decline in the malaria test positivity rate in 2019 following SMC implementation in Katsina, and same was also observed in Yobe. This just describes a quick impact of SMC on malaria test positivity rate across the LGAs where SMC was implemented in Katsina and Yobe state. But beyond malaria control, we found a 70% decline in referral cases in Katsina, while we found a 78% decline in referral cases in Yobe state. So what we are trying to say is that in Katsina, we found during the first cycle, about 2,891 cases were referred, and across the 4 cycles, there is a persistent and a consistent decline in the referral cases across the 4 cycles. So at cycle 4, we had 857 cases. This accounts for about 70% decline, while in Yobe State, we have 696 cases in cycle 1 and 156 cases in cycle 4. And this accounts for about 78% decline in referral during 2019 SMC in this state. We also went ahead to look at all-cause mortality data in Katsina and Yobe. We compared the mortality data in 2018 with mortality data in 2019 in both Katsina and Yobe State in the 8 focal local government areas. So in Katsina, we found about 45% decline in the number of mortality cases between 2018 and 2019 following SMC implementation, while in Yobe State, we found about 82% decline in mortality cases between 2018 and 2019 following SMC implementation. Let's not forget that in 2018, there was no SMC implementation in these LGAs. These observations can be correlated to SMC processes, including cyclical drug administration, like I mentioned, that has been conducted by the community drug distributors, the community mobilization activities by the town announcers and the lead mothers who move from one house to another to remind caregivers on administering 2nd day and 3rd day dose of amodiaquine, and also the referral processes being conducted by the community drug distributors as they move from one household to another. They identify sick children, regardless of the symptoms of their sickness, and they refer them from the communities to the health facilities for care. This provides evidence from the data we have gathered. There was as earlier shown, the persistent decline in the referral cases across the 4 cycles provides us with an evidence that the impact of SMC extends beyond just malaria control, as other identified sick under 5 children are referred to the health facilities for necessary treatment that they need, which includes further referral to higher level facilities, thereby improving general morbidity outcomes in communities beyond malaria. So the general morbidity outcomes that is going to be improved in the communities goes beyond malaria, because the referral doesn't identify just fever cases. The referral is spread across general childhood illnesses. So SMC was demonstrated to show these added impacts, and the extended services of the CDDs beyond just SPAC administration in the communities potentiate some opportunities for the health system, which include probable integration of service delivery, which is currently being explored, and also resources mobilization, amongst other opportunities that can be identified. Thank you very much for listening. Bye.